Hello, viewers. Hello, hello, hello. Welcome to the Confident Body series, proudly brought to you by TheBraGirl. In this series, we have been exploring practical ways to enhance our quality of life as women, because beyond what we wear, how we use our bodies play major roles in how confident we feel through every season of life. So if you've missed any of our past episodes, be sure to catch up at the Bra Girl, the YouTube channel, right? Don't forget to subscribe and turn on your notifications so that you do not miss whatever is coming up next. Today, I'm excited because we're joined by Dr. Bimpe Ayeni, and we'll be diving into another important topic for women. So please drop your questions and your comments in the chat section as we go on. We'd love to hear from you. Dr. Bimpe Ayeni is a board certified plastic surgeon and the former chief of the Division of Plastic Surgery at Southlake Health in Newmarket, Ontario. We'll be discussing breast reduction and augmentation, what women need to know. I need to know a lot about that. So, again, grab your coffee, get comfy, and let's get into it. Welcome, Bingpe. How are you doing today?
I'm doing well. Thank you so much for having me. It's a real pleasure to be joining you today.
Okay, right off the gates, I'm curious to know from your vantage point, and you're going to tell us a bit about yourself and what you do. But this is just like it's been on my tongue, the tip of my tongue. What's happening with women's boobs these days?
So again, thank you for having me. There's so many trends, and medicine is this fascinating field that is one hand very traditional, but on the other hand is ever evolving. So, some things don't change as time goes on, but with the advent of social media, I've seen a lot of changes in my practice, and I've been doing this now for almost 14 years since I graduated. So I am a board certified plastic surgeon, as you said. I trained at Yale, Columbia, Harvard, McMaster, and the University of Ottawa. And so I've been able to see how medicine is practiced in at least two countries, Canada and the US, and had some experiences also from doing medical missions abroad, one of them in Egypt with Operation Smile. Now, when it comes to breast, my fellowship at Harvard actually had a strong focus on breast surgery. And that was a wonderful chance for me to see just in high volumes a lot of different breast surgeries, reductions, augmentations, cancer reconstruction, men who have breast tissue and want it removed or downsized. And so it's nice to be able to sort of have seen that high volume of practice. And that's really helped set the path and set the tone for the work that I do now. Some things I'm finding more recently, number one, when it comes to breast augmentations, I would say 10 years ago, women really wanted to have as large as implants as possible that would sort of still fit their bodies. Whereas I would say now I hear a lot of, I know I could probably go with this size, but actually let's go back. Let's dial things back a little bit. So we are seeing a lot more subtle augmentations, which is a new phenomenon, I'd say in the last 1 or 2 years. But I have to say it's a change that I welcome. I like that because I think for me as a plastic surgeon, the biggest compliment of my work is that nobody knows I was there. I don't want people to look at you in a crowd and say, "Oh, I wonder if those are real, not." The whole goal is symmetry and harmony and just to really feel good in your skin. So reasons why somebody would seek an augmentation would be, let's say, someone who has had children, has breastfed, and finds that the volume in the breast has decreased or diminished. And they say, I wear my old bras, but I feel like I'm stuffing my breasts in the bra, and no amount of padding can give me the look that I had before. So it isn't so much that they're aspiring to be somebody else. They just want to go back to having something close to what they had before.
Hmm.
Another scenario that I see women for augmentation are those who've lost weight. And for anybody who's lost weight, we know if only we could pick and choose. Oh, I just want to lose, my cheeks, my stomach, my no. That's not how it goes. You lose the weight where your body wants to lose the weight. So sometimes I have discussions in women who've lost a lot of volume in their breasts, and they say, Doc, I just want to have something, I have a lot of skin, a lot of tissue. Um, but the fat that created the breast, the cleavage, is now gone. So how do we restore that? So, I think a lot of people, sometimes you hear plastic surgery and you think of the most extreme forms, whereas I would say 99% of my patients just want natural, subtle enhancements, and just to sort of feel like themselves, but just a different version. The other category of women who I see quite a lot are those seeking breast reductions. And I would say it's, for many years, even now, those patients, you can tell who they are in the waiting room. And that's because they are the ones sitting there with the biggest smiles after surgery. Even if they came in nervous or anxious, they are our happiest patients. And that's been studied. That is not just in my practice, but across the board with all my colleagues, because here's an operation that, yes, on one hand, we do make things look better. But the bigger portion of it is that we make these women feel better. They often come to
Okay.
us with a long list of symptoms. And as I'm sort of asking, I see a lot of head nodding saying, yep, yeah, that's me. That's
Yeah.
that too. So I would say the main things they come in with are things like, because of the weight of my breasts, I have a lot of neck pain, upper and mid back pain, pain in my shoulders. My bra straps leave grooves or little, divots in my shoulders. Uh, when it gets warm, or even if it's not warm, I have a lot of rashes underneath my breasts. So as you can imagine, it's a real quality of life issue. And I know, at some point there was a school of thought that said, well, if these women just lost some weight, they wouldn't have any problems. But what I find is these are the women who, even after weight loss, they haven't lost any weight from the chest. And so they just are carrying these heavy breasts that just don't usually match the rest of their bodies.
Mm.
And I think one thing that may be of interest to you is as part of my questionnaire, I'll always say, oh, just to get an idea of what they are thinking, what size of bra do you wear now? And what size do you think you want to go down to? And I never really guarantee because depending on where they shop, they can be one size in one store and a different size as another. But by and large, no matter how tall or short, or what their body shape is, I would say 90% of women who come in for a breast reduction consult tell me, and they are convinced that they are a 38 triple D. And so I will say, oh, sure, no problem, write that down. And, without fail, we do the examination, they take off their clothing, and they're wearing a 38 triple D, but that is not their size. That is not their size. They're far from it. So I've seen women who wear a K and L. Those are the ones who've gone and had a proper fitting and are actually wearing their right size. But I empathize with those who wear the 38 triple D because in most stores, 38, 40, 42 triple D, you can still buy off the shelf without having to go to a specialty store. And so there are women, there are many women, who are squeezing themselves into what is the easiest to get at their local store or at their local mall. So that's something I do see quite a bit in my practice. So I always say, instead of, correcting them and saying, "Oh, I can't believe I mean, I feel for them, I empathize, and I say, well, maybe after surgery, you'll be able to buy something off the shelf. But for now, this is a little snug. And you've probably seen the phenomena where sort of the bra is cutting in and there's some
Oh,
spill.
yes.
Hmm.
Oh, yes. I mean, we see that a lot. Like we always say 7 out of 10 women are not wearing the right size. And that, funny though, that just increases the neck pains and all of that. So those symptoms, it actually aggravates them as well. So some
Mhm.
women, if they were wearing the right size, for instance, probably wouldn't have had to come sooner than, than they
Yes,
did just because they are wearing the right size. Because support actually addresses some of these issues up to a large degree, to a large extent. So I am
absolutely.
totally fascinated that you have these conversations in
Mhm.
your office as well, because yeah,
Mhm.
it plays a large role. Wearing the right size plays a large role in
Mhm.
so many ways. Oh,
Yes.
okay. Nice. So I love that this is enlightening for me in terms of I've always seen it in black and white. If you're not going for plastic surgery for health reason, for
Mhm.
cosmetic reason, then it's for health reason. But now
Mhm.
you've brought the lifestyle
Yes.
part of things into it, which is very comforting. So women can be more open to like, okay, if you don't like how this looks or feels, you can actually do something about it without feeling like you want to look like somebody else. That's not what it is about, which
Right.
is very rich. That's a very rich conversation to have with anyone. Like you don't have to be big to even have that. Okay.
Exactly. Yeah, and
So
you're right.
what?
Because vanity, I think for in so many different spheres, women's bodies have been policed. And people like to tell women, how to look, how to dress, what to wear, etc. And I'm happy that nowadays, a lot of that noise is not totally silenced, but is being silenced. And so
Mhm.
we are the ones making decisions for ourselves and for our bodies. And so I think it's a very empowering situation where I see a woman coming in and saying, I feel this way and I would like to feel that way. So it's almost like a two-way. They're interviewing me, I'm interviewing them. Are we a good match? And so I like that exchange of information. And I think, yeah, it's imagine if you're very busty. So let's say, for example, one of my very busty women who is a size M or an N, and I do see this. And they are quote unquote top heavy and they want to work out. And they can't get the right equipment in terms of gym wear. They're wearing a medium bottom and getting a 2X top just to accommodate their chest.
Mhm.
And they're trying to run or do things that are more physical, but they can't get the bras that support them in a way that they feel safe and comfortable to do their workout. This is who a reduction really helps because it really just makes um, simple things that we take for granted that much smoother. So I always say that yes, it is a significant quality of life procedure.
Great, great. So ideally, what age should you elect for breast augmentation or reduction? And generally, how do you prepare for that? Because I'm imagining that after a certain age, you might not heal well, for instance. Maybe there are some things you need to do to have the most experience through surgery, something like that. So,
Mhm.
just talk about that a bit.
That's an excellent question. So, this is all part of what we call the preoperative assessment, just trying to get an idea of what is your general state of health and how will you do, given your state of health, how will you do after this specific procedure? Just knowing what the potential risks of any operation are. So, I do have some young women in the practice who come and they say, Dr. Ayeni, the teaching is wait until you've had children before you consider, let's say, a breast reduction for a few reasons. The healing, there's always a small chance that you can have a decreased chance to breastfeed. So some women say, you know what, that's important to me. I like to wait until after I've completed my family, and then I'll come back and see you and we can have this discussion. And I respect that. I have some young women. So let's say, for example, the ones who are professional athletes or in that category who say, I'm 18 and women now, sometimes choose to have children later in life, like I did. If I have children, it won't be for another 15 or maybe up to 20 years from now. So in that scenario, they're sort of looking at things and saying, do I live with these symptoms for a decade plus, or do I jump in now and do the surgery? Now, from my
Mm,
perspective, during that first operation, what I'm trying to get a sense of is the patient's maturity. I certainly wouldn't do surgery before a patient's at least 16, preferably after they're 18, just because of the maturity. In two ways. One, the physical maturity, because we want to wait until we know that they've stopped growing.
mm,
So you don't want to sort of jump in and do a surgery and the person has another growth spurt or the breasts get larger after surgery because you're setting them up for a recurrence of their symptoms and then needing a second surgery right away. And number two, beyond the physical, is the mental maturity. Just does this person understand that an operation is a big deal? Surgery is still surgery. Surgery has risks. If I feel that they are able to understand our discussion, understand the potential risks, potential complications, if I feel that they would be able to follow the post-operative course, as you can imagine, young people have very busy lives socially and with school and work and other commitments. So if someone is saying, oh, I play sports. I can only be off for 2 or 3 days, and I really have to get back into the gym or onto the horse or into the boat. That to me is saying that's not somebody who at this time is ready for surgery. So those are all the sort of things that I keep in mind in that particular age group. Now, for anybody who is beyond that, so they are mature, they aren't growing anymore in terms of breast size changes, then I'm looking at their overall health, any
mm,
health conditions they may have. So I start simply by saying, are you taking any medications on a daily basis? And that just tells me about their general health and how fit they are to have surgery under a general anesthetic. The healthier you are, the smoother your recovery will be. So I look
mm,
for things like if they are diabetic, and that's fine if they are. What is their control of the diabetes like? Do they have high blood pressure? Because if they do, anytime you do an operation where you're working on an area with very good blood flow, if your blood pressure is too high, it puts you at a higher risk of having issues with bleeding, for example. Then I look at other things such as smoking history. For me personally, in my practice, I've been very fortunate to have a very low complication rate because I'm very particular about who I choose to operate on. In general, I will not do elective surgery in smokers. And people say, oh, how come? Are you discriminating against smokers? And I say, well, I respect that smoking is a habit and I respect that it's very hard to quit. I get that part. As a surgeon, though, if I'm going to do an elective surgery, meaning this isn't trauma, this isn't somebody who must have surgery because they have cancer or anything of that sort, we're choosing to electively do an operation. Smoking really makes things challenging for both of us, myself and the patient. We know that smoking decreases blood flow
mm,
um, to the skin, so it makes it harder for you to heal. So my smokers are the ones who tend to have decreased or delayed wound healing. They're just not getting enough blood flow to the skin that we're moving around, and that's what nicotine does. And so I always
mm,
recommend, not just for me, but just for life in general, as a physician, as somebody who cares about people's overall health in my office and outside my office, I always stress smoking cessation. And that's something, there's so many different ways that we approach that nowadays. We don't say just, why are you doing this? Quit cold turkey, because that doesn't work.
mm,
But with the help of a family physician, there are different things, whether it's um, y- medications, the nicotine patches, there's so many different options available that can be tailored to the individual. So that's one thing that I always recommend that people not come into surgery having on board.
mm. I heard of pre-diabetes,
Mm,
as a condition you don't want to have going into
mhm,
surgery.
mhm.
What does that mean? Because that's I'm thinking to my mind is that you're not really diabetic, but you're on
Right.
your way there and
Yes.
you don't want. So how do women know this? Like,
Yeah.
how do I know that I'm pre-diabetic, for instance, you know?
That's a great question. So that's something that would come up with your sort of periodic health examination. So you see your family physician and you've done your blood work. And, sometimes if you just do your blood sugar that day, for a number of reasons, it can be a little bit elevated, it can be a little bit low. So it's very hard to know on any given day. It could be related to what you ate just that day,
Mhm.
which isn't something you would eat normally. So all those things can make your blood sugar look a little bit different. And that's why, at least for me, when I had my check earlier this year, my family physician sent me for a panel of tests. And so she checked something called my hemoglobin A1C. And that tells you about what someone's blood sugar control is like over a while, right? So based on that, you can get a good sense of what your sugars have been like for like the last 90 to 100 days. And that'll tell you like, hey, be careful, look out, you're in this range, or oh no, this is fine. So it's important to sort of, do all these tests and keep up with recommendations by your family physician to know. So folks who are pre-diabetic, that's your body sort of ringing the alarm and saying, we're not there yet. We're on our way. And, I think it's a very nice signal to listen to and to say, what can I change or tailor to keep myself away from the big D of diabetes and move myself back into the normal blood sugar range? And usually it's a combination of a few things, whether it's shifting diet, incorporating exercise. And I always say it's so hard to all of a sudden change everything. As in, oh, I'm going to
Mhm.
go home and everything in my fridge, I'm going to throw it all out. No, those kinds of interventions don't really tend to work. You can't sustain them. So it's often small, smart steps over a long time that really have a very big impact. So for those who are pre-diabetic, it's just, again, an alarm saying your control of sugar can be a little bit better. Why don't we address that? Let's address that through diet, exercise. Sometimes, in some cases, your family physician may think you need a medication to help with that. So that's my approach to it. I tell patients who are either diabetic or pre-diabetic that we'll keep a close eye on them. They do have a slightly decreased speed of healing, so things will take a little bit longer.
Mm.
And that's why, sugar is almost the way I see it is like it's an inflammatory substance to have in the body. So it kind of puts your
Mm.
body at high alert. And by keeping good blood sugar control, you really kind of quiet that
Mm.
inflammatory noise and you improve your own chances of healing.
Oh, that's beautiful. Okay, so whether you could be younger, not below 18, and have this surgery, or you could be older, what would you say about perimenopausal women and their risk? I had a question and you've already answered that, the pros and cons, and I hear that from what you've said so far. But we
Mhm.
work with quite a number of perimenopausal women, and
Yes.
I just wonder what either augmentation or reduction will be for them for their experience.
Another great question. Perimenopause is a transitional period where you're sort of dealing with a lot of different shifts and changes, all stemming from hormonal shifts and changes. It's a process that, of course, I respect, my colleagues and I respect, who do a lot of work with women and women's health. Um, for me, I think the biggest factor to keep in mind is just what perimenopause has impact-wise when it comes to weight shifts. So we know that weight can be a little bit labile in this period. I always say, 5 or 10 pounds of weight gain here and there is not the end of the world in terms of your outcome surgically. It's when you go beyond that and are more in the 20, 25, 30 pounds or more shifts that I say, you know what, let's really think about the timing of surgery. In terms of healing, I haven't seen any negative impact on how patients who are sort of 40s and beyond or 30s and beyond heal. And, I think in my practice, I welcome women in this age range just because of the maturity. These are women who have become mothers, they've raised families, they're still raising families. They are working and contributing to society, of course, in phenomenal ways. And sometimes the story I hear from them is that I've spent all this time doing all of that. I've spent all this time, raising my children and getting them sorted out. I've spent all these hours working and building myself professionally, but I'm coming to you because I want to focus on myself for the first time in a long time. And I think that's a very important discussion and conversation to have, is this idea that um, when you're looking after everybody else, who's looking out for you?
Yeah.
And, it's interesting that plastic surgery can sort of be seen as being a part of this bundle of self-care options that women have. Is you're focusing on yourself, you're focusing on the physical, you're focusing on your quality of life, you're focusing on presenting yourself to the world as the best version of yourself. We're not saying go wild. We're not saying change yourself because you, as you are, you're good enough. So I always
Mm.
jokingly tell my patients, I'm just taking you from that A to the A plus. You're great as you are, but there are just a few subtle things that you want to do that I can do safely in the course of a couple of hours of operating in day surgery. So we bring you in, we get you through the day safely, and then you return to your life. And of course, we keep a close eye on you. We follow up on you to make sure that everything goes well. And it often does go very well.
Hmm. Lifestyle. Sorry,
Yeah.
self-care.
Yes.
Wow.
Hmm.
That is a whole different angle to this. My, wasn't expecting that. Okay. Okay. All right. So, could you just walk us through the post-surgery process? Right. So,
Sure.
what does it? It's like, okay, just think of me thinking about doing this. What should I generally expect? For me personally, I'm thinking of scars, scar
Hmm.
tissue. How do you deal with that?
Hmm.
Do you lose nipple sensation,
Hmm.
for instance? And I know that if you've been carrying a lot of weight on your chest,
Hmm.
probably your spine has adjusted in one way or the other. So,
Yes.
would you need a therapy to do the physiotherapy for that, or you just let the body walk its, like water finding its level kind of thing? So, what should I generally expect also in terms of healing period? The kind
Hmm.
of support that I might need afterwards, because we see women come to the store and they just want sports bras. And we
Right.
tell them, oh, there are post-surgery bras actually, right, that
Hmm.
you could use right after your surgery. Then for
Yes.
the healing phase, there are different types of support you can have. So sports
Mhm.
bras, maybe not really, because it's also about the fabric, how
Right.
and how that rubs on your skin or reacts to your skin, with your
Right.
skin rather. So yeah, just a general after what you need to know, what I need to know,
Mm.
if I'm thinking
Sure.
or considering this.
Yeah, no, that's an excellent question because I think that's such an important part of the recovery process. We don't just do the surgery and say, okay, all the best, because it's so important to maintain that great outcome. And there are a few things to really optimize. So, number one, you mentioned the dressing. So, for my patients after surgery, we want you to wake up because we know that the anesthetic is a wonderful nap, but you wake up and you're sort of, a little disoriented, a little
Was it?
groggy. So we don't want to make you have to work so hard to think about, okay, what was the next step? What did she say again? So, what we do is I do the surgery and then I put some skin tapes on the skin to protect it. And these are waterproof because we know some people more than others are shower takers as opposed
Mm-hmm.
to bath people. And everybody wants to, within a few days feel more normal and get back into their routine. So that's step one, is ensuring that dressings and wound care are taken care of. If I find that I need to use a drain tube after surgery, which isn't, I don't do it all the time, only in my much larger reductions. So my M's, my, K's, my L's. And then we set up home care so a nurse can come by and give them a hand with that, just to sort of take away the need to do so much active care while you're trying to recover, because resting, of course, is very important. After those waterproof skin tapes, then we just wrap you with some gauze for comfort so things aren't rubbing and irritating your skin. Um, and then you go home and we say finding garments that make life easier is important. So I always recommend to my patients to have a bra with a front closure. That way you don't have to worry about reaching back and trying to, turn a bra around just for those first couple of weeks to really streamline the recovery process.
Mhm.
Having help is important for those who have young kids at home because we want you to not do too much heavy lifting or pushing or pulling for those first couple of weeks, because any of that will put a lot of tension on your incisions that are trying to heal. Now, the question about scarring. So, when someone comes in for surgery, I do a lot of drawing with a marker on their chest, and then they go to sleep. And those markings help me and they guide me in how I'm planning all my different incisions. And, you know, um, many of these have been tried and tested for decades, many, many, many years. And the reason why we use the ones that have this long history is because we know it really minimizes the amount of scarring and it minimizes the amount of tension on the wound. So, unfavorable wounds result from poor planning or someone who's not experienced in doing the procedure, and then the placement of the suture. So those are all the things that I keep in mind, not the day of surgery, but the day I met you. So I've already in my mind mentally mapped out, okay, you know what, this for this person, I would shift and do things this way, given their particular situation. So yeah, all that pre-planning really helps. So, closing the wound in different layers so that there's not tension, so things don't pop and open up and things like that.
Mhm.
And that all comes from, just many, many years of doing a lot of these kinds of surgeries, over 1,000 at this point. Um, so that's how to minimize scarring. And then occasionally you get somebody who everything went smoothly, they were healing very nicely, and then you see they have a thickened scar 6 months down the line. We always say scars keep on maturing over that first year. So in the first 12 months, initially you'll see the scars very pink or purple, and then we recommend scar massage, which is something my patients hear me say all the time. You can't over massage a scar. There's no
Mhm.
such thing. The more you can massage, the more you just really help speed up the process of healing, and you end up with very beautiful, faint scars. And so I always recommend that. Patients always do quite well when they do it. But if for some reason the scar is not favorable, I'm here. They come back and they see me sometimes, and not very frequently. I've had to inject the scar with cortisone if they're thick or keloiding. But what I will say is in people with a range of skin types, even people with my complexion, like what we say skin type 5 or 6, the scars on the chest tend to be quite forgiving. We don't tend to have to do a lot of revisions.
Mm.
So whether you're pale, olive skinned, dark skinned, the scars usually end up healing quite beautifully. But patience is important. You have to give it time. So I wouldn't jump into, let's say, for example, remove a scar or fix a scar at 2 or 3 months because the scar hasn't finished healing yet.
Healing.
Hmm.
Yeah. Yeah.
Hmm.
What about nipple sensation?
Yes, nipple sensation. So it's one thing I always discuss as a risk. So for certain procedures, let's say you do a breast augmentation and you place the implants in through the bottom portion of the breast, the odds of having nipple sensation changes where you lose sensation is pretty rare, to be honest. For the reduction, because we're doing a little bit more aggressive work on moving the areola and the nipple to a different position, usually to a higher position, small chance of changing sensation. And small chance, I mean, if it were to be decreased, it wouldn't necessarily be on both sides because they're considered separate procedures within the one surgery. So I tell patients, you may lose sensation in one nipple, maybe the other, not usually both. But again, it's not common. It's something that we warn about, but with the right planning, the right drawings before surgery, the right surgery for the right patient, it's not a very common complication.
Oh, okay.
And one interesting thing to add to that is just the idea that some of my patients who have had very large pendulous breasts for a number of years sometimes come in with decreased sensation anyways because of just the nerves that go to the nipple have been stretched out for a long time. But
Mm,
interestingly, even in those cases, and those who aren't even that big, a common discussion that I have with patients when I see them the first time after surgery, some of them say, "Wow, my sensation increased. How did you do that?" And I say it's just because when things are stretched out, and then we bring them back up into a higher position, sometimes the reaction to the body is, oh, great, this is, more comfortable. And they do have more sensation. So I always warn patients that be careful during that first shower after surgery, because for some women, even just the water touching the chest can cause this hypersensitive reaction where they're just not used to it.
mm,
I say not to
mm.
worry. That's a temporary phenomenon. It does get better as time goes on. So, on one hand, yes, you may lose sensation as a very uncommon complication, but you actually may gain some after a reduction.
Nice. So the
Mhm.
spine, what happens to the posture of the spine after? Do you need a therapist or a physiotherapy
Good
or
question.
just
Good question. So it's so hard. Back pain is a challenge. And there's so many reasons why people can have back pain, whether it's trauma, whether it's other issues, whether it's, curvature of their spine that they may or may not know about. So what I find is a lot of women who are heavy breasted, who've had a reduction, again, they're the ones sitting in the recovery room smiling widely because they just feel so much better so quickly. So a lot of women feel the relief because the bra isn't having to work so hard to carry that weight in the shoulder, neck, back, especially if they're wearing the wrong size bra to begin with. So generally speaking, after surgery within several weeks, there's really a relief that they feel because all those symptoms are alleviated.
Mhm.
In some women who have had more chronic symptoms, more long-standing issues with neck and back pain, they may need a bit of help. But this certainly takes the weight off, and it even makes it easier. If you're going to go and do some work with a physiotherapist, you're just able to move with so much more ease and grace that it makes that easier if you need it. But by and large, most women just feel better without having to have any other interventions, no pain blocks, no physio or anything of that sort.
Great. I don't know if this is a question I can ask, right? But I mean, what should women prepare for in terms of budget for
Mhm,
this? And are there any government assistance to this, especially if your reduction is health related, like your
mhm,
doctor advised you to just go for a reduction? Are there
mhm.
any government assistance, and what should the woman generally budget for in doing this?
That's a great question. So, as it is in Ontario where I practice, whenever I see someone for a breast reduction consultation, I send a letter to the Ministry of Health and long-term care, and the letter just states what I think, what my findings are. So I usually start by asking the patient to name their own symptoms, and I put all that into a letter in their own words, just so that it's an accurate representation of what they're experiencing. And that goes off to the ministry, and the ministry will then either approve or deny. And thankfully, the ministry is quite reasonable, so that if they do see a list of symptoms that they think has an impact on quality of life, then they will approve it, meaning the surgery is at no cost to
Hmm.
the patient. Then there's some women who their bra size, because I put all that in the letter, bra size, height, weight, symptoms, doesn't qualify them for that, then the ministry will say no. And those women are looking at more of a cosmetic lift. So they're the ones who've lost a bit of weight. They don't have symptoms, but they just don't like the way the breasts look outside of a bra. So that is an out-of-pocket expense that they have to pay. And the same goes for breast augmentation. So breast cancer reconstruction is with implants is all covered by the ministry because of the cancer diagnosis, which I think is wonderful and necessary. Breast augmentation for cosmetic or aesthetic reasons is not covered. So, ballpark figures, you're looking, it's definitely a five-figure procedure. And so what I do is I always bring somebody in and have a look at them and customize what I think the pricing should be for the individual because there's so many factors that come into it. So for example, am I just putting in the implants? Am I putting the implants and doing a lift at the same time? That takes a bit longer. So of course, if it takes longer, they're under the anesthesia for longer. So I have to pay the anesthetist for longer. So that's why it's hard to give a very specific number. But that's kind of a general range of where those kinds of surgeries are. So you're looking at the $10,000 range, potentially a little below, potentially higher, depending on all the different factors. Lift, no lift. And one last thing I'll say is oftentimes some women come and see me and say, you know what, doc, if we're going to be making the upper portion smaller. What about my lower portion? What about my abdomen? So then we sort of combine things in a way that makes sense because they're right. If they are already under the anesthetic and they may have, whether it's a hernia or diastasis or extra skin on the abdomen, then we would do that all in one setting. And that's why I think it's important to meet at least once, sometimes even twice, face to face, to have a whole assessment just to see what procedure or procedures make sense because not everybody needs all the different surgeries.
Okay, so this video will be viewed from different provinces,
Mhm.
right? So, and you are in Ontario. If people
Yes.
want to reach out to you, what would be the process, the standard process to reach out to you,
Yes, great
right?
question. I'm happy to chat with anybody. I do also offer virtual consultations. That way we can speak and get to sort of understand your health, your wants, questions you may have before we arrange to meet in person. And the best way to reach me is to send an email to my office, which is at manager at drbimpe.com. So manager at DRBIMP, like Peter E.com.
Okay, okay. Thank you for that. What else do you think we should know about this? Like, summing it all up, what else would you say? Before we even go there, this just popped up in my mind. Some
Mhm.
women don't want to have anything to do with their breast reduction or augmentation, either way, because of cultural inclinations. They just feel, oh, we don't do this, or we don't, yet
Right.
their quality of life is below par. What would
Yeah,
you like to say to those people? Because they're suffering all of this, but they're like, oh, we don't do this in, oh, this is not, so what would you
right,
say to
right.
them?
It's a great question, and I think I always remind people that plastic surgery, when we first started hearing about the field, it was something that was somewhat elusive. It was, oh, it's only the rich people have plastic surgery. We thought about it being this Hollywood
Hmm. Vanity.
insider. Yes, and exactly. Vanity was the number one reason for it, but a lot of us have really worked to broaden the definition of plastic surgery and to say that it's plastic and reconstructive surgery so that we're not just doing it for vanity's sake, even though, you know what, we all deserve to be a little bit vain, in my opinion.
Hmm.
I think
Hmm.
we are living longer than anyone has ever expected, right? So 50 years ago, people weren't talking about living into your 90s. And I have many patients who are 90 and above who I see and are still in good health and they're not going anywhere. So I
Wow.
think if you have the chance to live your best possible life, instead of saying, oh, why am I doing this? Why should I do this? What will everybody think? Ask yourself, why not? Why
Mm.
not? Why not you? Why not give yourself a chance to live in a way that is pain-free, in a way that you feel comfortable in your skin? And like I said, plastic surgery isn't to make you stand out. or have people look at you and point, and the second you walk into a room, they sort of are wondering what you've had done. No, the vast majority of us as plastic surgeons love being able to be what we call your secret agent. No one needs to know that you've actually met with us. So long as you leave the process, you've made a decision that you're comfortable with, you leave feeling like the best possible version of yourself. Whether that means having less pain, feeling more comfortable in your clothing, not feeling like you're hiding yourself or hiding your body, being able to enjoy activities, whether it's athletic activities and sports, and just really having the best, version of yourself being seen by yourself and by others, I think is not vanity whatsoever. I don't even think it's a luxury. I think it's just a way to approach the next phase and phases of one's life. Myself, my colleagues spend all this time in school, so you might as well take advantage of us because we're here for you.
Right.
And it's not meant to be a judgmental process. It's just helping you to achieve goals that at some point may have seemed unattainable. Um, but the important part for those who have the symptoms and feel shy about it is you'd be amazed at how many people have had plastic surgery. And the reason for having discussions like this is to normalize the process,
Mhm.
and to say that nobody's judging you. You know, Surgery nowadays is very safe. And our goal, again, is just to really have you present yourself as the best version of yourself.
And that sums it up. Thank you so much. I would call you a beauty secret agent.
I like that. I like that.
You have shifted quite some thoughts and mindset around this. For me personally too, right? You've shifted a lot, and I know that when people listen to this will broaden the conversation in their minds. Because what this has done for me right now, experiencing you, is to broaden that and soften the judgment around it, And I think that I appreciate that a lot. Thank you so much, Dr. Bimpe Ayeni, for coming here with me today. Yes, we'll reach out to you. I'll put your email right there. This will be uploaded and people can reach out to you when they need to. Yeah.
Wonderful. Thank you so
Thank
much
you.
for having me. Thanks for the excellent questions.
Yeah. I appreciate you a lot. Okay.
Thank you.
All right, viewers. So if you like this video, like it, share it, yeah, and subscribe, as I said before, and we'll bring more things your way under the Confident Body series. Remember, that's what we're talking about. So till next time, everyone, have a good time.